What's up, guys? This is Derek, moreplates.moredates.com. Today we're going to be talking about, does Dutasteride lower testosterone levels? So I did a video on Finasteride, and if Finasteride lowers testosterone levels, I felt like a video on Dutasteride was justified as well. Because if you saw the Finasteride video, you already know that Finasteride does not lower testosterone, which is, a common misconception. And a lot of times doctors will even tell you that. I've had doctors tell me if I wanted to assess how well it was working to check my testosterone, because it's going to be reduced from the Finasteride. It's definitely not the case. If you look at the Merck official brochure, it shows a 15% increase in testosterone and estrogen as a result of Finasteride usage. The reason for that is when testosterone hits 5-alpha reductase, if it's inhibited, you now have a blockage between the testosterone being converted into DHT. So therefore, testosterone that would have otherwise converted to DHT stays in testosterone form. So now you actually have more testosterone than you would have otherwise. In turn, you now have more testosterone that also aromatizes into estrogen. So, the net result of that is a 15% increase in testosterone and estrogen. A lot of people would want to know, and something I wanted to know too, is how much would Dutasteride increase testosterone? Because obviously if you're inhibiting more of the 5AR, naturally you would think, okay, well, that's going to increase test even more. And you would be correct. It's a bit harder to find the statistic though, but I did find it. So found a study, effects on 5-alpha dihydrotestosterone and testosterone. The maximum effect of daily doses of Dutasteride on the reduction of DHT is dose dependent and observed within 1 to 2 weeks. After 1 to 2 weeks of daily dosing with Dutasteride, I'll post the study where you guys can reference this data for yourself as well. So 0.5 milligrams serum DHT concentrations were reduced by 85%, 90% respectively. And after 4 years, it was 94% inhibition at year 1, 93% at 2 years, and 95% at both 3 and 4 years. So, approximately Dutasteride inhibits DHT by, 93 to 95% after it's been fully saturated in your system. I think that's pretty established. If you go look at my testosterone also causes hair loss, not just DHT video, I had inhibition of DHT to undetectable levels. Like it was so low, it was undetectable. So I can only assume it was around 93, 94, 95%, if not closer to 99%. As far as, okay, well, if you've inhibited your 5AR to that extent, how much, obviously you have a total blockage now essentially of testosterone staying as testosterone instead of having a certain percentage converted to DHT. The median increase in serum testosterone for these same patients with those reductions in DHT was 19% at both 1 and 2 years, 26% at 3 years, and 22% at 4 years. But the mean and median levels remained within the physiological range. So what that means is, compared to Finasteride, Dutasteride will increase your testosterone by approximately 5 to 10 more percent. So Finasteride is 15%, Dutasteride's somewhere in the ballpark of 19 to 26. So not significantly more, but it's notable for sure. And one thing that should be noted too is within the physiological range. So that means that the reference range for testosterone, taking Dutasteride wouldn't push you into genetic outlier territory. So you wouldn't get genetic phenom testosterone levels by taking Dutasteride. It's going to boost it a significant amount, but not enough to push you into steroid user territory. So anyways, that's just a quick video for you guys to put out a statistic that I thought is really good to know, especially if you're on this drug or whatever, then it's good to know what's going on in your body, especially if you don't get your blood work consistently. So that's gonna be the video. Just a quick one to let you guys know what you can expect exactly statistically from Dutasteride and what it's gonna do to your hormone profile. So anyways, thank you guys for watching. Please like, subscribe, drop a comment, check out my blog, moreplates.moredates.com, for article versions of these videos, article format with all the clinical studies linked there. Thank you guys for watching. Talk to you soon.